All week long, I've been interviewing doctors and other healthcare professionals about what's going on in Alberta hospitals, and it's not pretty. The stories are not pretty, and you've seen the videos, and the doctors are exhausted and pushed right to the edge. Well, worse is coming, and they have said that the system is a week or two away from being overwhelmed. I'm going to talk to Mike Parker about the Alberta Health Sciences Association, and he's going to give us the inside view. So, welcome to the interview, Mike.
Thank you, Markham.
How bad is it, sir?
Markham, I'm going to tell you this, that if we go back a year, because this COVID's been hanging on 9 months now. And so if I go back a year, I can tell you that our healthcare system in Alberta was under immense pressure. So if we take that lens of the pre-COVID days of a system that was under immense pressure at the time, and 9 months later, where our folks have been on the front lines battling with no relief, no reserves to come and back them up, they have come to a point where there is just not a whole lot left to give. And as we see now, our numbers are escalating to 12 and 1,400 new COVID cases daily. Our death rates are climbing. Our admissions are climbing. We didn't have the capacity to accept this a year ago. We have been underwater for 8.5 months now, and we're at the point where there is just nothing left. Our overtime calls, so as an example, a worker will go into the respiratory therapist, or a mental health worker will head into work, and the nonstop calls for overtime because there is just nobody left to fill the positions. The exhaustion, the sickness, the mental health toll that this is taking on our people. If you look at the paramedics who are running code red daily across the province, are running code red everywhere all the time now. It is just absolutely to a point where there is nothing left. And now we have a mass escalation in cases, and we have a government that has chosen not to do its part as leaders in this province. And effectively, I'm not saying we had to lock down. I'm saying we had to do something. Maybe a mask bylaw would have been an appropriate piece, but there was failure in leadership there too. So these folks are not supported, and they've been on the front lines for 8.5 months with no relief.
Okay, let's talk about what this means in practical terms. What I saw in my interviews, Mike, was doctors. I mean, these are dedicated professionals in tears because they were being asked to do the difficult, and now it appears, and they know it's going to happen, they're going to be asked to do the impossible. And they're not sure that they can do it. They're not sure that the system can support them to do it, and it is causing them enormous stress, they're telling me.
Markham, the impossible they're talking about is making those life and death decisions that have to happen. We don't have the capacity, we don't have the room, and who gets to move into a ventilator and who doesn't are the decisions that are coming now. It is the absolute, nobody got into a profession in healthcare to have to make those kinds of decisions. And in a strong public healthcare system, we should never have to make those decisions. And here we are. We don't have any room left.
Okay. It's horrible. And I just finished interviewing today Dr. Neil, forgot his last name, doesn't matter, rural doc, south of Calgary. And he looks at his system and he says, okay, normally what we would do if we had somebody really sick, like a severe COVID-19 patient, we would send them to the cities. Now the cities are going to be full. Now what do I do with them? I don't have ventilators. I don't have the medicines I need. I don't have any of this stuff that say a Calgary Foothills hospital would have, and yet now I'm going to have these people in my hospital. And so is there a kind of a divide between rural and urban?
Markham, our healthcare system in Alberta is set up as a hub and spoke system. The most intensivist care systems are within the Calgarys and Edmontons. The lesser levels you might find in a Lethbridge or a Red Deer or a Fort McMurray, and then out into the smaller rural services where they have general practitioners working in hospitals as well as clinics to try and manage healthcare for the rural communities. And he's right. As folks get sick and need higher level of care, they start moving them into the system. And they go from maybe ground ambulance from small town to Red Deer, maybe air ambulance from Fort McMurray into Edmonton. This is how a system works so that we're not putting highly expensive systems out where nobody uses them. It's how it's designed, and it works. What we don't have is the capacity anymore. We have 100-some ICU beds across they're full. They're all full. And so that whole intent of pushing people into the centers can't happen because the centers are full. And they're not just full of Edmonton and Calgary. They're full of the rural folks as well that have been already moving into the system as it was designed to do.
There's another issue that's rearing its head we haven't talked about a lot, but the doctors are starting to talk about it, and that's they're starting to see patients with long COVID symptoms. So these are people who have maybe were sick, recovered, but now they're suffering all sorts of other medical ailments. And of course, that just contributes to the burden on the healthcare system, would it not?
We've only been experiencing this brand new virus for a year. The research is still coming in. We don't know what we're dealing with here. We haven't clearly defined if it's a reinfection rate. We haven't clearly defined what the long-term issues are with COVID. We don't know. And so we're still navigating that. Medicine is always an evolving science, always an evolving and getting better at capturing. That's why our survival rates were going up for a while. Well, now we're being overrun and we don't have time to focus on survival rates. We're just trying to barely keep our heads above water here as the numbers just keep climbing, and we are not responding in a way that's going to help us here.
Okay, so I don't know how many people are going to watch this. I do know that our other videos got very, very good coverage, and it'll be thousands. And most of them will be from Alberta. So what is your message to Albertans? What should they do?
I first need to address all of those members on the front lines of healthcare today to remind them that we are there with you. This is the hardest days ahead of us, and we are nowhere near being done what we have to deal with. Stay strong and stay safe and protect each other. On the issue of the rest of our province, all Albertans, please take heed. Stay home. Wear your masks in public to keep us all safe. Because at the end of the day, if our healthcare system truly does collapse, there is nobody left on the line to protect you.
Mike, that's a sobering message, and thank you very much for this. And it's certainly a message that Albertans hear. We thank you for it.
Thank you.